Topic number 8, wound classification, classification of wounds, healing of the wounds, lecturer Shevchenko Alexander, Baltic Federal University, Medical Institute, Kaliningrad, 2020. So, what is the wound? It is a circumscribed injury which is caused by an external force, and it can involve any tissue or organ. Here on the picture we see eagle who made injury to the Prometheus, mythical hero from ancient Greece. Wound primarily divided on two types: surgery wound, making the sterile conditions in the operative theater; accidental wound, all wounds made not in sterile conditions in result of trauma. Classification of the wound: mechanical: abraded wound, punctured wound, incised wound, cut wound, crush wound, torn wound, bite wound, and shot wound. Chemical: chemical wound can be made by acid or base compounds. Wound caused by radiation. Another type: wound caused by thermal forces. It's burning, freezing, and special wounds. First mechanical wound is abraded wound, superficial part of the epidermal layer, blunt trauma. It's mild wound, and it's usually good healing wound. Punctured wound: sharp or pointed object, anaerobic infection can be in the layer of the tissue because it can be very deep injury. Injury of big vessels, parenchymal organs, nerves, and thorax. It can lead to the pneumothorax. You must provide X-ray because some part of this weapon can be obstacle into the body of the patient. Wound healing of these wounds is bad. Incised wound: usually made by sharp objects, wound edges even, wound corner narrowing, no strong destruction, but check the wound base. Best healing, and this is a type of surgical wound which we make by scalpel. Cut wound: sharp object plus blunt additional force. Usually you must look for foreign body as textile or parts of the clothes, edges, even or uneven. Bad wound healing. Crush wound: usually made by blunt force, pressure injury, connective tissue and fat, edges uneven and torn. In the wound cavity we can find destructed tissue. This wound have bad wound healing too. This is makeup. This is not actual wound, but you must understand torn wound. It's great tearing or pulling makes this wound. Incomplete or complete amputation of the limb, or the part of the skin, or the part of the body. Uneven wound edges, raised wound wall, strong bleeding, foreign body, and contamination of the wound as usual we can see in the torn wound. Bad wound healing. Another very specific type of the injury is gunshot wound. If we have a person who fired in the patient from the close distance, patient can have burn injury. Often in the cavity of the wound which made by a gunshot we can find foreign materials like oil, metal and soot. It's very bad healing of the wound, and you must understand we have entry wound and we have exit wound. Always entry wound is lesser in diameter than exit wound. We have blind wound if bullet go to the body of the patient. and stays in the body of the patient. And we can have exient or through wound if we have bullets that made their way through the body of the patient and go out from the body of the patient. Another specific type of the wound is bite wound. It's not an anatomical classification because you must understand bite of the cat and bite of the tiger. It's different type of the wound. Damage depends on the teeth of animal and the bite force. A rage wound, crushed tissue, torn, punctured. It can lead to the bone fracture even if the dog made this wound. Severe infected wound, we must always think about prevention of rabies if this is wild animals, and tetanus prophylaxis if wound will be if wound was contaminated by ground. Here we see normal skin, two layers, epidermal and dermis. And here we have incision wound, triangular form, it's even edges of the wound, laceration wound with uneven edges and not sharp object and maybe blunt trauma, abrasion, it's surface trauma, puncture wound, penetration wound. Of course, you must understand that penetration wound doesn't mean that you puncture the skin. To penetrate, you must enter to some body cavity, to abdominal cavity or pleural cavity or cavity of the skull. Contusion and hematoma. Contusion and hematoma made by blunt force and don't rupture the skin. Burns. We have several types of burns. Thermal burns. Burns due to external heat sources which raise the temperature of the skin and tissues and cause tissue cell death and charring. Hot metals, scalding liquids, steam and flames when coming in contact with the skin can cause thermal burns. Radiation burns. Burns due to prolonged exposure to ultraviolet rays of the sun or to other sources of radiation such as X-ray. Chemical burns. Burns due to strong acids, alkalis, detergents, or solvents coming into contact with the skin and or eyes. And electrical burns. Burns from electrical current, either alternating current or direct current. We have four types of burns, 4 degrees of thermal burns from the heat. First degree, superficial burns. First degree burns affected only the outer layer of the skin, the epidermis. The burn site is red, painful, dry, and with no blisters. Mild sunburn is an example. Long-term tissue damage is rare and often consists of an increase or decrease in the skin color. Second degree, partial thickness burns. Second degree burns involve the epidermis and part of the lower layer of the skin, the dermis. The burn site looks red, blistered, and may be swollen and painful. Third degree, full thickness burns. Third degree burns destroy the epidermis and dermis. They may go into the innermost layer of the skin. The burn site may look white and blackened and charred. Fourth degree burns. Fourth degree burns go through both layers of the skin and underlying tissue as well as deeper tissue, possibly involving muscle and bone. There is no feeling in the area since the nerve endings are destroyed. On this picture we have seen all degrees of burns. Here we see all the layers of the normal dermis, epidermis and the deeper tissues. When we have first degree burn, we have only erythema on the outer layer of the skin. When we deal with second type of degree, we have erythema and blisters. Blisters can fill with yellowish cirrhosis containing. In third degree of the burns, all layers of the skin is involved. And when we talk about fourth degree of the burns, all layers of the skin and deeper tissues are damaged. Here we see on the picture first degree burn. We have here mild erythema on this hand with no blisters. This is second degree of the burns. We see here mild erythema and blisters with the yellowish color. We saw here yellow color because it's plasma. Third degree burns, no blisters, all layers of the skin is damaged here. And fourth degree burn. We see here that we have damaged skin, we have some blisters, and here we have damage to the more depth than skin tissues. And another one picture of all four types of the burns: mild erythema, erythema with blisters, erythema, blisters and damage of the all full thickness of the dermis, and more severe, more deeper burn here, which take